Hey, Catalyst community. We just finished an interview with Joseph Marcus out of Australia. He's the founder of Airbands, which is one of the top devices in the world when it comes to blood flow restriction training. Now, wait a minute. Blood flow restriction training. I know. I knew nothing about it just a couple of months ago, but the evidence is deep. This is very, very fascinating opportunity for everyone from healthcare providers to athletes, and we talked through all of that. So enjoy the interview. As always, this is the unedited advanced release of an episode that will hit the Catalyst Health, Wellness, and Performance Coaching podcast in a few weeks, but we always like to get these unedited ones out to you who are subscribers here on the YouTube coaching channel ASAP. So if you haven't yet subscribed, it's a great way to tell us you like what we're doing. In the meantime, enjoy the interview, and let's go be a catalyst. All right, Joseph Marcus, thank you for joining us, buddy. This is going to be an intriguing conversation. I appreciate you making time for it.
Cheers, Brad. Looking forward to it.
So let's set the stage a little bit, because as I mentioned to you when we were talking beforehand, a lot of folks are like, wait, blood flow restriction training? I don't even know what that is. I did some research leading into this, obviously, but what is it? How's it used? And how long's it been in and we'll use mainstream a little bit soft here today, but talk us through that a little bit.
Yeah, so the method of blood flow restriction training dates back to the very late 1960s with its development in Japan. When it became popular or more mainstream in Japan in the early 1990s, in the West in the early 2000s, when it sort of gained more notoriety and use in the literature, some first exposure, but then also clinically with sporting teams and practitioners using it for rehabilitation mostly. But the prominence of blood flow restriction training over the last 5 years has gained momentum dramatically because because if you can't engage in high load training because of injury or being load compromised, there's no real good second option. So BFR lends that sort of applicability as being a good second option to high load training.
So tell us a little bit more about, I know what it is just because I've looked at some of the videos and that kind of thing, but for the person that's listening to this on a podcast and they're like, wait, what? I mean, you're essentially restricting the blood flow to some of the major muscle groups as you're working them. Give us a little visual of that so people understand what we're talking about.
Yeah, so blood flow restriction training is the application of a tourniquet-like device applied to the upper limbs. So for the upper body, it would be the most proximal humerus area. So the deltoid, tuberosity is the landmark you're looking for. And for the legs, it would be the basically inferior to the inguinal fold, basically as high up on the thigh as possible. So you have the application of tourniquet devices on the limbs in combination with exercise, typically low load exercise, so around 30% of the previous 1 RM. And what that does, so basically the addition of the restriction bands or the blood flow restriction causes the muscle to fatigue at a much lower threshold than typically that would happen. So, and that fatigue is what is instrumental in causing the positive adaptation. So because low load training isn't ineffective and high load training is very effective, but basically it's training to failure. So 10 RM is 10 repetition max. So the amount of weight you can lift 10 times. So theoretically you can't lift an 11th rep because you failed at 10. Right. So that's why high load training typically is very effective because it's psychologically, physically very difficult, but psychologically lifting 5 reps versus lifting a lighter weight 50 times or 100 times. It takes a lot more psychological energy and also it takes a longer time as well. So that's why low load training isn't typically prescribed and typically well tolerated by people in a rehabilitation setting or athletes trying to gain a performance edge, because it's difficult to implement and difficult to basically progress because you're training at so many reps and doing so many sets. So BFR training decreases the amount of reps required to reach failure. So say without the application of blood flow restriction, you'd need 50 reps to reach failure with a low weight, say 20% your 1 RM or whatever it may be. With BFR, you reduce the amount of reps required, so you fail much more quickly, and you get a lot more benefits in a shorter period of time, depending on the previous level of your previous level of fitness. So if you're quite detrained, you would get a much more pronounced response, but if you're quite trained, the response might be a little bit diminished.
Okay, and just for the folks listening that say, "Wait a minute, did he say a tourniquet?" And for those of you listening and not and you're not pulling this up online or something, it literally is like a tourniquet at the top of the, kind of where the biceps drop back into the deltoids, and then at the top of the quadriceps. So, um, can you talk us through some of the, just throw out a study or two on this? I know there's a ton of research on this because I dug in before we chatted, but the folks listening are going, wait, you're telling me put a tourniquet on my arm and that's going to give me an advantage either in rehab or as an athlete? Give us a couple examples if you could.
Yeah, quite interesting example from 2 years ago now, 3 years ago now, 2018, was with elite powerlifters. Basically, with a powerlifter, you assume that they're at their threshold of muscular development, as you would imagine with strength training. But they, so this was a study by Braun, and yeah, it was basically with national level powerlifters, application of blood flow restriction training in addition to a 6-week training block. And then the interesting thing about this study, it was not even concurrent, basically sessions. It was sort of separated by a rest period in between. So it was 2 1-week blocks of BFR training, and it led to, the strength, there was no, and at the end of the intervention period of 6.5 weeks, they didn't have an improvement in strength, because you would assume a national
Sure,
athlete would
be at the
threshold of strength, but they had an improvement in quite a significant improvement in muscle size, which is quite interesting in that study as well. So with sort of an elite sporting sort of athletes can still get a performance benefit from lifting, say 30% their 1RM. So that was quite an interesting study, which came out sort of with elite sports. In terms of more sedentary populations or whatnot, I think that's probably where the bulk of the sort of benefits can be seen, is the fact that like it seemingly leads to comparative results. One study from 2012 by Lorento was looking at again, physically active males, so not elite athletes, but still physically active males. And one was doing high load training, so they were looking at doing 80% their 1 rep max. So I think the traditional sort of 3x8 rep scheme, and this was a full body knee extension exercise. And then also the BFR group was looking at training with 20% their 1RM, and there was more of a high rep, sort of 3 sets of 15 or so. And at the end of the 8 weeks, so they were doing 2 sessions a week. I think probably looking at close to a 40% improvement in the strength, in 1RM strength at the end of the intervention period, and probably around a 6% improvement in hypertrophy, and the same for the high intensity group as well. But the usefulness is in that particular scenario was one group was lifting 80% their 1 rep max, and the other group was lifting sort of 20% their 1 rep max. So you've just reduced 60% of the load necessary to sort of see equivalent responses in strength and hypertrophy. So yeah, so that I think again, and I think that's probably the usefulness of BFR training would be the decrease in sort of joint stresses required to achieve results. And I think the results are more profound with sort of the more detrained you are. So if you're a highly trained athlete, you may get some benefits from the addition of blood flow restriction training. But if you're returning from an injury, if you're elderly, if you're detrained, I think that's where you get a much more pronounced exercise effect.
Well, and as you were saying that, I'm thinking exactly what you just said, the elderly opportunity here. If you've got a 70-year-old that's wanting to stay fit, but doesn't want to be sitting there throwing 200 pounds on to squat or, bench press or something like that, any safety considerations here? Has there been anything out there of, well, you need to be, obviously you can't tighten it too much, but any guidance along those lines for people that are saying, I need to check this out?
Yeah, there's just like generally with exercise prescription, there is contraindications to doing blood flow restriction training, which would be similar contraindications to doing exercise training just more generally. But basically, immediate red flags which come to mind with, say, safety concerns, which probably most people have in their mind when they think about tourniquets and whatnot, would be DVTs or venous embolisms would be number one. History of any sort of hypercoagulability or like blood clotting disorders, and then lymphedema would be something else to flag. Active cancer, and peripheral neuropathy or diabetes would be sort of immediate contraindications, or at least warrant medical follow-up just to investigate sort of, because I think ultimately with any modality, it's safety is the balance. So the definition of safety is the balance between risk and reward. So
Exactly.
I think nothing's inherently safe. It's just the risks, the rewards are outweighed by the risks. So, but in some circumstances, the risks may be higher than the rewards, and then maybe you don't complete that modality. So I think it's up to the individual to determine the suitability of those things. But basically, understanding there is some contraindications and risks, but there is a multitude of rewards available. But whether that's on a case-by-case basis worth it to the individual.
Okay, good. So endurance training versus strength training, is there a value for, let's say, a marathon runner, a triathlete, anything? Because when I think, okay, in the first study, the elites had hypertrophy, so that's just adding weight. So that the endurance athlete doesn't want that unless there's strength that goes with it. Have there been any studies done that you're aware of that benefited the marathoner, the 10,000 meter runners, the track athletes, et cetera, outside of, say, a 100-meter runner?
Yeah, there hasn't been so much that I've read anyways, so much to look at sort of the application in particular endurance sports of that nature. There's definitely aerobic benefits that can be achieved with BFR training, just generally with the application of blood flow restriction and cardiovascular exercise. So in terms of what that looks like, the protocols generally, so say for strength training, they're looking at the application of 4 sets of an exercise with 50% restriction of blood. And then that's sort of the strength protocols. And for improvements in sort of VO2 max or aerobic improvements, the application is about 40 to 50% of the current VO2 max, or using heart rate reserve as the percentage to train at, so 40 to 50% of that value. And just engaging in low load aerobic exercise can lead to improvements in VO2 max in individuals. There wouldn't be a multitude of studies looking at, but there is quite some emerging literature looking at the aerobic benefits of blood flow restriction. And yeah, there's one study which comes to mind by Abe in 2010, which is basically the addition of blood flow restriction to low load cycling 3 days a week, 15-minute sessions. And they compared that to free flow exercise for 45 minutes for the same three sessions a week for 3 weeks. The free flow exercise training at 40% of their VO2 max had no improvements or very little improvements in muscle strength and VO2 max. But then the BFR group had, I've just put it up now. So they training at 40% of their VO2 max for 15 minutes, 3 times a week for 3 weeks. They improved quadricep muscle size by 3.4%, quadricep strength by 7.5%, VO2 max by 6.5%. And that was their training at 40% of their VO2 max for 15 minutes. So I think in that example, it lends itself to some interesting applications in terms of endurance athletes, whatever it may be, 5,000 meters or 10,000 meters or ultra. It'd be difficult to determine. But the interesting thing is the utilization. Basically, I imagine the fitness of the muscle to utilize energy is improved with exercise training just generally, and I think blood flow restriction training improves the ability of the muscle to use and utilize energy much more efficiently, the same way as exercise training does generally. So I think in terms of improving aerobic performance in that respect. I think that it would be limited in terms of as you get further and further away to more of the aerobic system, then the cardiopulmonary system becomes
Sure.
more of a driving force. So I think as the distance increases, maybe the utility of BFR training decreases in terms of that in that athlete. But for say, particularly for a detrained athlete, the application of BFR training to improve aerobic fitness would be a good utilization, because it just generally improves the muscle function and the ability to utilize energy. So that would then allow for a higher level of cardiac output. But say someone who's very trained, then it might be the result of BFR training would be diminishing slightly.
Yes. Okay. You really get my attention now. This is interesting. So would they actually run with these on their quadriceps, or does that only work with cycling because you've got a little bit more separation? What have you seen folks using it in running?
There hasn't been, I haven't seen running, but definitely sprint walking intervals and cycling and rowing up other exercises, which are, there was one study which I can recall was with sprinting. So, but they were running at a reduced rate. So they weren't necessarily sprinting. I think they were training at, say, it may have been sort of 50% their max sort of speed. I'll have to pull that up, but because the addition of blood flow restriction, I think it's quite interesting in terms of the applications in the space of more performance. I think that's a space which probably could do a little bit more deep diving into, because strength and hypertrophy can be sort of studied quite easily in a lab, I imagine, but I think the higher level sort of performance aspects, I think there was some studies looking at futsal and at the application of blood flow restriction training into session, and there was some interesting results with that. But in terms of elite sports or prolonged aerobic activities, I can't recall doing any studies.
So another question down this path. So when you think of a triathlete or an endurance athlete, one of the problems is fitting everything into your life. So if you have a tempo ride day where you're really hitting hard on the bike, then you go out to work out in the gym and you're just like, you're cooked. There's just nothing there. I'm imagining that you're saying, okay, you do the hard bike workout and then you do the BFR. And now, even though you're tired going into the weight workout, you can still get benefits, even though your body's not ready to do the, 1 rep max or even 5 rep max, but we can drop that down. Am I hearing that right? Is that the potential you're talking about?
That's quite, because that's the question which comes up quite often is basically the application, because there's no doubt that BFR training is a useful modality, but the user case in terms of how, when, and why you use BFR is sort of a little bit the unknown at the moment. So people know it's a useful modality, but then how do you utilize it to get the most effect? And I think having discussions sort of along those lines over the years, I think, as you mentioned, for a apparently healthy athlete who has no other injuries or whatnot, the application of BFR probably would be a user case, as you mentioned. So if they're psychologically fatigued, if they're physically fatigued, and the idea of doing a second session in a day with heavy resistance training isn't possible, and then still being able to get a stimulus into that day with a low load session, which then will offer results which are more profound than low load training. I think that's could be quite a useful application of BFR training. Would be the fact that if you went out for a 10-kilometer run and you were quite central nervous system was quite taxed, and you were in the idea of doing sort of heavy resistance training wasn't possible, the application of BFR training to a low load session would be a good user case, I would say, in terms of that application, just to get in that volume of training without exerting, without sort of the additional physical stress, because you are training with 20 to 30% of your 1 rep max. Right. It is BFR training isn't easy in terms of the metabolic effect, because you get so much, because basically, so how the BFR training works is when you apply the cuffs to the upper arms or legs, arterial flow from the heart is underneath high pressure. So it goes into the limbs. And then basically how blood flow works is the veins then bring the blood back to the heart, which are underneath lower pressure. And with blood flow restriction training, you're sort of you want to be more specifically targeting the venous return back to the heart, which is underneath lower pressure, but you are partially restricting the oxygenated blood into the limb. But so because there's blood always going into the limb, you get that blood pooling effect of blood not being able to come out, and that's what causes the basically muscle fatigue. So you get that muscle burn feeling. So it's not the exercise isn't easy.
It's not like it's easy.
But it's not once the cuff comes off, you don't feel that heavy aching of having done a 5x5 squat session or whatnot, which you get typically.
Right. Okay. Yeah. So
it's very,
interesting.
very, very, very transient in terms of the response. In terms of it's very difficult when the cuffs are on and you're exercising, but once the cuffs come off, within 3 to 5 minutes, you've got free flow blood flow, and you feel quite recovered.
Okay, so what if the reverse is done then? Instead of, I'm more endurance focused, so I would do the bike first and then go do the gym. But with this, it sounds like, hit the weight room, do this, because as soon as you take those things off, you're gonna be fine. Now you can hop on the bike and do your thing. Is that more?
I would say you would emphasize what was most important to the athlete, but that sounds like because you won't. I don't imagine, if anything. There was one study which came out, which is quite interesting. It hasn't got a full ground base. There's not a multitude of studies to support it just at the moment, but it was looking at the application of blood flow restriction with one exercise. In that study, it was looking at a dynamic lunge, split squat exercise, and application of blood flow restriction training, doing I think it was 4 sets of 12 of a lunge exercise with blood flow restriction cuffs on the legs, and immediately taking the cuffs off and then completing a jump exercise, and the flight time was improved by 4.9% immediately afterwards. So there was a neuromuscular patterning kind of potentiation occurring, which improved the physical outcome of jumping. So that's I find that interesting in terms of because typically for neuromuscular activation, you're training with heavy weights or doing some sort of strenuous active drill. So the application of BFR, some body weight squats, and then saying that improves a physical outcome like jumping. Then there might be some use of it pre some sort of physical drill or activity where BFR could be a useful addition. So in that user case, say if the athlete was doing a weight session with BFR and then went to the cycle, I'm curious to know sort of how their session would go. I would say that just anecdotally, I haven't sort of read that, but I wouldn't imagine that would be too taxed in terms of compromising this performance on the bike. Okay. But that'd be something to be explored.
And then I've read about potential benefits on recovery days. What are your recommendations in terms of athletes or individuals using it as a recovery tool to make that in-between day allow them to get more results, but not feel the fatigue that sets up the following day as a disaster day?
Yeah, that's a good one. In terms of the use of BFR training as a sort of active recovery tool, I would say in terms of there wouldn't be too many studies looking at basically it improving recovery, but in terms of how it could improve scheduling of exercise sessions, would be the fact that what we just discussed in terms of the exercise dose is very low in terms of what's being exerted upon the joints and ligaments, that you could still get an exercise session in between heavy training sessions. Right. So I imagine
it's not improving your recovery. It's just allowing you to do that workout with less need for recovery.
Exactly. I would say that and less strain and muscle damage occurring. So you're not getting the complete sort of tearing of muscle fibers, and then excessive joint stresses and the taxing system of on the central nervous system. So I'd say, because it works more metabolically as opposed to mechanically. So the mechanical stress of heavy weights isn't there. So the system of metabolic fatigue can be cleared by the body quite effectively after the tourniquet has been removed. So it's very much more a transient response. So it's in athletic populations, they've looked at doing BFR training daily. So I think 6 days in a row in one study. And that led to an improvement of I think that was of power and strength. So in terms of versus high load training, it seems to be well tolerated in that respect. But just like anything though, it still is an additional stimulus. And as with an athlete who is conscious of their load they still have to be mindful of where that sits into their training schedule. So,
right. So do we need to, with that said, do we need to cycle on and off? Do you need to use BFR for a month and then not for 2 weeks and then come back, or what do you recommend there? And I know not everything's established with complete, detailed research, but what are your recommendations?
yeah, in terms of cycling through BFR, there'd be no reason to cycle on and off. You're not going to get in terms of basically if you're not using it on too many on too many consecutive days, you're applying basically the same principles of exercise prescription. So one day on, one day off, maybe alternating between muscle groups, maybe and alternating between aerobic and resistance training as well. You'd be okay to implement BFR on the long term.
Okay.
And yeah, basically the only thing you do is every 2 weeks or so reestablish your values for the pressure that you're using, and get another baseline and continue exercising again.
And in terms of those values and the pressure, you're the founder of the Airbands. Do the Airbands do that for you? Is there any? I'm thinking the athlete that's working out by themselves. Athletes, we can be a little psychotic sometimes, like, oh, I'll just go harder. Are there some things that they need to be aware of, or does the Airband or other devices like it protect you from being an idiot?
Yeah, that's probably the main point to emphasize with blood flow restriction training, is because the pressures used are submaximal, because you're still wanting oxygenated blood to enter the limb, which makes that's what adds makes it effective. Is the fact that there is oxygen, and makes it safe as well. The fact that there's oxygenated blood entering the limb, and you're only sort of specifically, hopefully, targeting the deoxygenated blood, so the pressures are submaximal. So that value is traditionally called arterial occlusion pressure, also referred to as limb occlusion pressure, which is basically the amount of pressure required to cut off blood flow distal to the application of a tourniquet. So with some devices don't do that, and then application of a distal probe is required. So say with more manual devices, the cuff goes on, a distal probe is applied to the radial artery, the cuff is pumped up, and at the point where the radial artery is absent, that's determined to be your occlusion pressure, and then you exercise at 50% of that value. So say if that was 150, your BFR pressure would be 75. And the idea there is it's high enough to target a venous flow back, so you've diminished venous flow, but it's low enough to allow arterial flow into the limb. So that's what helps with the cell swelling, causes all the blood engorgement, then causes the fatigue in the muscle, and that triggers some pathways to improve strength and hypertrophy. So that's basically submaximal would be what you're after. And with Airbands, they have a mapped algorithm where they basically a sensor which determines sort of the blood pressure, the blood values to be used, and gives the athlete that value automatically, so without the necessity for a distal probe.
So there's not really the athlete that's like, oh, I'm going to go hard. That's not a thing. Like the machine keeps you from being an idiot, basically.
Yeah, the machine makes recommendations to use. Basically, values are presented to you, and then there's prefixed values of percentages to use. Okay. But so I'd say it's strongly encouraged that you don't succeed. Those basically 50% is generally a benchmark to be training around with BFR training, and there's no reason to go any sort of higher than that unless you've been advised otherwise, or have are working with a specific goal. So for strength and hypertrophy, 50% of that value seems to be a very good place to be training at of the limb occlusion pressure. In some studies, they've used higher pressures, but they're trying to achieve different results. So for strength and hypertrophy, endurance would be 50%. But say if you're using BFR training to cause modulation of pain responses in a limb, so say someone who's had a recent knee, has anterior knee pain, that they've done some studies with application of 80% of the pressure value to reduce pain acutely.
Right.
And that seems to be quite promising in pain reduction, and also in the absence of exercise, and you're just trying to use BFR training passively to prevent muscle loss. Again, using 100% has been shown in some studies to be an effective way of reducing muscle atrophy without the presence of exercise. But the idea, I imagine, like how I visualize it, is kind of like a seesaw. So if mechanical stress is very high, then you need very little BFR. And so if the athlete can train, if the athlete is training very heavy, then they don't need any BFR.
Sure.
If the load is 50%, and then maybe they can use a little bit of BFR to get additional stimulus. And if the load is very little, maybe they use a lot of BFR to get the stimulus. So it's kind of like it works inverse.
So we've been talking mainly about athletes, but you touched on the rehab setting there. Can you talk us through how it's been used there? Is it primarily knee surgery, shoulder surgery, elbow? What are some of the most common uses in the rehab setting for the BFR? Because everything you've told us would fit for the rehab setting, but where are you seeing this used the most?
Yeah, the most wide adoption has been post-operative ACLs. Has been because I think with post-operative ACLs, there's such a small window where you can gain a lot of benefit by preventing atrophy. So I think 48 months post-operative, most ACL patients still experience knee pain, which is directly associated with quadricep strength. Because quadricep strength is the number one predictor of outcomes post-op. Yeah, so if you can prevent the loss of quadricep strength post-operatively immediately, then you've just accelerated the rehabilitation program, because if you haven't lost the muscle strength, you don't have to regain it. So that's why BFR in that acute period seems to be very widely used by elite sporting teams, particularly in the US, I would say, who have been on the forefront of utilizing blood flow restriction training post-operatively in an elite sporting setting. I would say the majority of professional teams in the US would be using blood flow restriction training in some way, but most likely post-operatively, most likely with ACLs.
Achilles, biceps, elbow.
Yeah, there'd be no reason why the application of BFR for the same injuries, say an Achilles, whether it's repair, whether it's ulnar collateral repair, whatever the condition may be, if you can benefit from the maintenance of muscle mass and the improvement of strength, BFR training, and if you're worried about the graft or the surgical site being compromised by high loads, BFR seems to be a very very good option, and particularly if you can use BFR in multiple ways. So the roadmap for, say, using blood flow restriction training, say if you used an ACL as an example, the athlete ruptured their ACL. Typically, if they rupture the ACL, they've also then damaged their medial collateral ligament and also the meniscus. So they've done a lot of damage to their knee. So that they may be not that ambulatory. So, and typically, I think they wait 4 weeks or so between injury and surgery to operate on. But the application of BFR sort of post-injury, pre-surgery, to maintain or improve quadricep mass as much as you can leading into the surgery would be a good option. And then a study has looked at applying blood flow restriction training. I think it was as little as day 2 post-operative for the ACL, and they used it for day 2 to day 14. And in that study, it hasn't been super widely researched in terms of its ability to prevent muscle loss. It's quoting a handful of studies, but in the Takarada, I think it was 2000, looked at a 50% reduction in atrophy in the quadriceps. I think it's a cross-sectional area of the leg. With the application of blood flow restriction at very high pressures. Again, not widely replicated, but again, an interesting study to look at. But the combination of different layering modalities, I think the coupling blood flow restriction with sort of knee exercises, which can be done passively in bed, coupling the blood flow training with electrostimulation, there seem to be promising things to improve the effectiveness of other modalities. But say for a ACL, so you can use it preoperatively, you use it immediately postoperatively, passively, and then once able, maybe the addition of blood flow restriction plus cycling to again improve quadricep mass and cardiovascular fitness, and then the addition of blood flow restriction training just to closed chain, open chain exercises. So it sort of gets you to the point where you can begin more strenuous rehabilitation exercises, but without having as much downtime in between injury and more medium to high load training.
Right. Wow.
So So that seems to be how the elite sporting teams are using it. Basically, in those acute periods where load is an issue, and they can bridge the gap between no training to high training.
Okay. Okay. So a lot of our listeners are health and wellness coaches. So it's outside of our scope of practice to say, you should try this. But as we continue to see this more and more, clients are going to be asking about it. What are some of the key questions the coach should ask the client to clarify whether maybe it is something they should look into or not? I mean, is this something, you know what, it's for pretty much everybody, post-rehab, post-injury, pre-surgery, athletes. Is there anything they should be looking for where the person kind of gives them a red flag that, better not talk about this much?
Yeah, I'd say the clients' preparedness for exercise generally. So if they haven't much experience with resistance training, just DOMs in particular, muscle pain, they're very like if you didn't advise someone that they're going to experience muscle pain or DOMs post exercise,
and DOMs is delayed onset muscle soreness. Everybody, just for the rest of the folks.
Yeah. And then if he took them to a strenuous exercise session, 2 days after or a day after, they might think something's very wrong, I imagine. So I think with blood flow restriction training, just letting them know that what they experience of muscle tightness, engorgement, transient discomfort is very normal. And then
during the exercise.
And be able to differentiate between normal symptoms and bad symptoms. So bad symptoms would be changes in temperature of the skin, so cold, hot, so inability to determine temperatures of the skin because that means you've affected the nerve too much. Pins and needles would be one, and it's kind of like any sort of sharp shooting pains. So being able to discern between those two sort of okay reactions and not okay reactions to the blood flow restriction. People's sort of ability, robustness to withstand sort of discomfort as well. So if someone doesn't typically like resistance training anyways, and then you're not only getting to do resistance training, you're also then getting to do resistance training underneath an additional stimuli, could be not a good fit. But just generally, there wouldn't be, beyond medical red flags in terms of contraindications, I'd say BFR training would be useful for most populations, barring any sort of explicit contraindications, because I think that it's, in terms of pain, it's not uncomfortable. It's just, it's not painful. It's just relatively uncomfortable. But you sort of get used to the discomfort after a few sessions.
Right.
And I think there wouldn't be, in terms of broaching it with a client or athlete, if an athlete would benefit from expedited exercise sessions because of time inefficiencies, then BFR would be useful. An example was recently with the COVID situation was gyms closures, right? And we had a number of clients, elite sporting team clients, who procured some blood flow restriction cuffs to train in the hotel rooms because they didn't have access to high loads on their machines.
Right.
So it just trying to improve the effectiveness of body weight exercises, trying to improve the effectiveness of low resistance exercise tubing. Blood flow restriction could be useful in that sort of remote exercise setting. So if you have a client and you're training them remotely, then taking some BFR cuffs with you could be very useful. So that could be a useful strategy. For an athlete who doesn't like resistance training, BFR could be a useful addition because a lot of those football players or soccer players is probably don't like doing resistance training and they like training on the pitch. So BFR training in the addition of bodyweight exercises or sideline exercises could be a good way of introducing load and preventing sort of improving robustness in the athlete, but without having them get them in the gym. But that'd be the user cases in terms of why BFR may be useful in sort of an athletic setting. But I would say just generally, there wouldn't be too many populations which would say it's not effective for, but just understanding how, when, and why you're using it, and using it with sort of intent. So if you have an athlete who has lower back pain and you're saying, okay, yeah, I can't get him to squat, he's going to miss a squatting session, but we can put some BFR cuffs on him and get him to do some body weight squats. At least that way he's still getting his movement pattern of a squat, in, but we're not, and we're improving his glute strength, we're improving his quad strength, but we're not exacerbating his lower back pain.
Right.
So that'd be a good addition to a blood flow restriction. If an athlete, like as you said, had a game, they were injured, but just generally after, say, a football game, after a big run, you're not injured, but you have niggling sort of ankle pain, elbow pain.
Yeah.
So the addition of BFR, the low load session afterwards, to sort of stimulate some improvements in strength and hypertrophy, but without the wear and tear, that could be a useful addition. And then also supplementing high load training. So if you got an athlete to do 5 sessions of high load training a week, so 80% of their 1RM, they eventually going to get injured at some point, just through general wear and tear. But if you supplement 2 or 3 of those sessions with BFR sessions, you're still getting in a high dose of stimulus, but you're reducing the wear and tear on the athletes, the mileage on the athletes' joints. So I think that could be an interesting way of looking at it. So whether it's 2 high load sessions, 2 BFR sessions in a week, or whatever that may be. But I think it'd be good to hear from, because currently BFR is quite interesting. It's very lab based, as in like it was sort of born out of research.
Sure.
It was used clinically, but then the user cases weren't super well developed in terms of how a endurance athlete uses BFR, how a basketball player uses BFR, who's injured and not injured. Do we include it into the in-season use? Do we not include it in season use? Does it replace high load training? Does it supplement high load training? Like, so I think the user map is something which I look forward to, when basically, as it gets more widespread, strength coaches using it with their athletes and figuring out, oh, hey, if we use some BFR push-ups prior to a bench press strength goes up.
Yeah.
Or whatever it may be, or whatever it may be, or if
the recovery days, or
or recovery days. I think I've had some interesting conversation with some baseball coaches and strength and conditioning coaches working in baseball about how they utilize blood flow restriction training as sort of a flushing, active recovery, muscle stimulation modality pre-post pitching. And then they get anecdotally getting results, and that thing's very interesting to me in terms of like where the literature is going and its user cases are going.
Yeah. Wow. Joseph, this is so fascinating. I knew you were going to wake me up to some things, but the utilization seems so widespread potentially. For folks that are wanting to hear more about Airbands, or they want to follow what you're doing or some of the research, what's the best way to keep track of you? What's the best way to tap into what you've got going?
Yeah, so the airbands.com or airbandsbfr.com would be a platform to reach. We're very active on Instagram, and it's airbandsbfr as well. And basically Airbands BFR across all our platforms. We're mindful of the fact that education and content is useful as well for a lot of people. So we're trying to put out some research studies and of things of that nature. So I think we're most active on Instagram, but again, the website, and you can reach us directly via email as well, info@airbandsbfr.com.
Okay.
And I can be reached directly as well through that email channel. But yeah, so I think happy to reach out in any way of being useful. I think it's still an emerging area. I think a lot of high level strength coaches are aware of BFR now, but again, and then I think the next sort of 5 years will be people that gain confidence in using BFR.
Oh, yeah, and things like this where people go, oh, I had no idea.
Yeah, I'll say as people get, as utility gets more widespread, the individual user cases will increase, and then people will research that and become quite commonplace to use BFR in more unique situations.
Right. Well, I really appreciate you joining us. I know your schedule's a little haywire sometimes, and we're figuring out the time difference between Australia and the US, but thanks for making the work. Really appreciate it.
Cheers, Brad. Thank you very much for your time, mate. Much appreciated.